So, welcome everyone. We'll be continuing with the lithium psychopharmacology sessions. So, today we have a question from INICT May 2023, which says, which of the following is true about lithium? So, option A is fine tremors are seen at therapeutic blood levels. Okay. Lithium is not absorbed from the gut. C doesn't cause teratogenicity, and D is approved for abscesses. Now, which of the following is true? Now, the answer is that even at the therapeutic blood levels, we are seeing fine tremors. So, fine tremors are not actually associated with toxicology of the lithium. It's actually the coarse tremors, which is a part of lithium toxicity. Okay. So, let's just look into it. So, see, this is how it is. So, fine or postural tremors, this is perfectly normal, not a sign of toxicity. Okay, so this is propranolol responsive. However, it is this coarse tremors which is of immediate, which needs immediate intervention because it's a clinical warning sign of intoxication. So, see, so if it's fine like this, just propranolol is our only response. But if it's coarse, then it is a problem. Okay, so the coarse form of tremors of lithium is the thing that we should be worried about. This is toxicity. Okay, so this is what is the textbook says. Textbook is Kaplan and Sedok. So lithium induces in most patients a mild resting tremor should be examined regularly by the psychiatrist in the office by observation. This is not a Parkinsonian tremor. Lithium may result in an action tremor at, so it is an action tremor. So whenever the patient will try to say pick up some object, when an intention or action is there, then only there will be tremors. Okay. That's also a mild resting tremor. So it's a resting tremor or a action tremor. Okay. And these are all at non-toxic therapeutic level. So resting tremors as well as action tremors. A stable lithium tremor is the absence of in the absence of toxicity may, however, be distressing and impairing to the individual. Yes. Nonetheless, although it's not a toxicity, it will be a source of distress for the patient, specifically for those people who are on a daily basis using their fine motor skills, like a musicians or perhaps a surgeon or an orthopedician. They will be facing a problem which is distressing for their work life. Okay. And for this fine tremor, we are giving propranolol, maybe say 30 mg in three divided doses. That is 10 mg in three times a day. Okay. So let's see the other options. So option B is wrong. Lithium is a quite small uh, agent. Actually, it's high, as a result of which it easily crosses the gut lumen and into the blood. Okay. So this statement that it is not absorbed from the GI system, that is completely wrong. Okay. C is wrong because C is telling that it is not causing teratogenicity, but we know that lithium is indeed a classical teratogen. It is producing this Epstein's cardiac anomaly, okay, which is associated with elevated risk of displacing the tricuspid valve. Okay, so this becomes something like this. Okay, it will be something like this. This is Epstein anomaly. Sorry, this is actually sort of like this. Okay, it will be displaced somewhat over here. Okay, so as a result, there is actually uh, the chamber of the right ventricle is smaller in volume, as well as the blood is not getting emptied properly from the right atrium into the right ventricle. So it will be say like somewhat like this. Okay, so the blood won't be able to pass into here. So this is the anomaly with lithium that we are seeing. And the third was mood stabilizing properties. Okay, that lithium was supposed to have mood stabilizing properties, right? Approved for absence users, but no. Lithium doesn't have any role in absence users, not it is having any anticonvulsant property. Okay, so among the mood stabilizers, we can see over here that carbamazepine and valproate are the only two who are having both mood stabilizing as well as anticonvulsant properties. Over here, ethosuximide is a pure anticonvulsant which we are using, and lithium doesn't have any anticonvulsant property. It is only a pure mood stabilizer. Okay, so with that, we cover today's MCQ. Hope you have learned something from this. Thank you.